Welcome in this evening. I'm Lizzie Arbogast, sports editor at Tallapoosa Publishers, alongside managing editor Santana Wood. How are you doing this evening?
I'm doing good. It's Friday of week number 5 billion of working at home.
Yeah.
Lost track of time.
Yeah, it's pretty good that it's Friday, except that not that much changes, Well, I don't come to the office.
The news still goes on the weekend.
Yeah, it
News never
does.
sleeps.
Yeah, the news never sleeps, and neither do we. No, we do sometimes, but we do appreciate you guys joining in this evening. Obviously, we appreciate the support of our sponsor, Russell Medical Wound Care and Hyperbaric Medicine. Couldn't do it without you guys, as well as our viewers. So we do want to talk a little bit about face masks tonight, something we haven't really discussed too much. And as businesses are starting to open, people are encouraged to continue to wear those face masks. While they're out and about and in public.
Yeah, so the CDC says that you do need to wear those cloth face coverings, not surgical mask or N95 mask, especially in areas where social distancing measures are difficult to maintain, such as grocery stores. This is something that the Alabama Department of Public Health is strongly recommending for the Safer at Home order as well. And you have to wear it the right way as well.
Yeah, so we wanted to kind of show you guys the right way, demonstrate. We both have our masks here. So I have a medical mask. I have a couple of these that someone sent to me. I also have a fabric mask, and Santana has her fabric mask. So when you're wearing these medical masks, you may want to make sure that this blue part is on the outside, and again, that it covers both your nose and your mouth completely, like this.
Yes, and make sure it pulls over your chin so you cover your mouth, your nose. You don't want to wear it. This doesn't count. You want to cover every part of your mouth and nose as well. The purpose of wearing a mask is not necessarily to prevent you from getting the virus, but to protect other people from getting it from you. And this is something that Dr. Penny Watts at UAB School of Nursing said as well. And it also helps you not touch your face.
Yeah, which I'm apparently really bad at. Like, I've noticed very much that I touch my face a lot. So it is also important to remember that before you put on that mask, and as well as when you take it off, that you wash your hands or use that hand sanitizer. So you're making sure that you're clean when you are having to take your mask off or put it on. You want to also make sure that it's fit snugly, but also comfortably, either ties in the back or has those ear loops like some of the medical ones do. I do know it is hard for us people who wear glasses because I tend to, it's under your glasses. So then you breathe and it fogs up your glasses, but we got to do what we got to do. And if you are using a fabric mask, obviously make sure you're cleaning that. You can use soap and water, but also put it in the washing machine at least once a day will definitely help protect that.
I'm demonstrating you're supposed to tie these top straps first and then the bottom straps. So make sure that and then adjust it. So make sure that you tie those fabric masks correctly as well, and fold it like so, outside in, and of course wash it.
Yeah, and it's important to know how to use these masks because a lot of businesses, especially those smaller businesses, are requiring the use of face masks. Here in Alexander City, Russell Ann's Marinas are going to require that you have a face mask when you go inside, as well as Half Moon Market. Those are the two that we know of for sure, although I'm sure there's several others that are doing the same thing. Just make sure that if you have trouble breathing or you're unable to remove your own mask, as well as if you're under 2 years old, not to wear those masks just because that can create another danger that's not worth it.
Right, definitely. So we just wanted to talk about those face masks a little bit tonight, show you guys the correct way to do that and give you some facts on those, as many of our viewers are likely wearing masks everywhere they go. We also want to give y'all an update on the Alabama Department of Public Health's most latest numbers as of tonight. Statewide, they have the confirmed cases of COVID-19 have topped 7,000, now at 7,294 as of 6:40 p.m. And that's an increase of 226, which is our largest one-day increase in more than a week.
Yeah, I was kind of disappointed because I was looking at the numbers about 2 hours ago or so, and it was only at like a 94% increase, and I was like, "Wow, like we're really, making headway." And then got the numbers for the show, and unfortunately, that is not good to see. But again, this is why we're trying to make sure that you guys are still taking those safety protocols as you head out and about more and more in public. There are now 289 deaths across the state, which is an increase of 17 since last night's show. And there were some increases in our counties as well.
In Tallapoosa County, there was an increase of one, now at 286 confirmed cases of COVID-19. Still 18 deaths in Tallapoosa County, but we have also learned as of this morning there have been 18 deaths at Bill Nichols State Veterans Home in Alexander City. We can't guarantee at this time if those 18 are the 18 that Alabama Department of Public Health is reporting at this time. Very well could be some differences there, but we do know that 18 have died at Bill Nichols, and there are 18 reported by the state. No way to know if those are exactly the same or not.
Yeah, so over in Elmer County, there are now 88 confirmed cases, which is an increase of two. There are still two deaths there. And Coosa County is at 29 cases and still with one death. Those are no increase in either of those categories. We did want to bring you guys some good news. We've talked a lot about recoveries and wanting to get some recovery numbers. And so we got a little bit of that for you guys today anyway.
Yeah, so Friday, Alabama Department of Public Health spokesperson Dr. Karen Landers said that more than 2,300 of those who have been tested are no longer ill or have recovered. So really good news to hear that. This isn't something that's available on Alabama Public Health's dashboard that reports the cases at this time. Dr. Landers announced that during a virtual town hall this morning, but Alabama Department of Public Health is working on getting that recovery category on the website, we have been told.
Yeah, and I think it'll be really important for people to see that and to know, the good news as well as some of the more grim news for sure. So we want to take a quick break, and we're going to hear from our sponsor, Russell Medical Wound Care and Hyperbaric Medicine, and we will be right back.
At Russell Medical Wound Care and Hyperbaric Medicine, we want you to know we're open. We take COVID-19 seriously and have put precautions in place for the safety and health of our patients. Don't delay treatment. Wound duration lasting more than 30 days is less likely to heal naturally. We treat all types of wounds, cuts, and burns, so intervene early. Wound care is critical. Call us today.
Hey, welcome back in. I'm Lizzie Arbogast, sports editor here at Tallapoosa Publishers, alongside my managing editor, Santana Wood. We talked a little bit of face masks, a little bit of numbers, and now we do want to get to some local news for you guys. As we did say that we have confirmed that there were 18 deaths here at the Bill Nichols State Veterans Home here in Alexander City, and 85 veterans have tested positive. That does not include employees. We know that at least some have. We haven't gotten the final count on that, but they have tested all the residents. And there are 42 residents who are considered active positive at this time.
Yeah, so the investigation of Bill Nichols State Veterans Home in regards to the outbreak has been completed at this time. Teams from the Alabama Department of Veteran Affairs spoke this morning and said that the Alabama Department of Public Health, as well as the Federal Department of Veterans Affairs, pretty much agreed, and they have some minor recommendations as far as what the Bill Nichols staff can do to remain safe for the residents as well as the staff members. But ultimately, they did release those findings this morning. Said that they were just really in agreement that there wasn't one thing that they could point out other than they do have some recommendations to share.
Right. So that'll be good, to see how that kind of plays out. And hopefully, obviously, those veterans are getting the care that they need at this time. Main Street Family Care has had a corona antibody test available since Monday. It is available at all of the locations, including the Alexander City location. There are some questions about costs, but they're thinking that it should be covered under insurance. And already 20 people have been tested at the Alexander City location. And that test tells you if you've already contracted it or been exposed to it.
Yeah, so pretty interesting. And no appointment is necessary for people to receive that antibody test or the viral swab at any of Main Street Family Care 16 locations, which there are many in the Tri-County area. Also, over in Elmore County, the Alabama Department of Corrections today confirmed that one staff member of Elmore Correctional Facility has tested positive for COVID-19. This staff member was promptly self-quarantined under the direction of their healthcare provider, and the Department of Corrections then initiated an investigation to determine if any inmates or employees had exposure to the staff member. And that investigation is ongoing at this time.
Yeah, so over in Tallahassee, they are preparing their annual senior awards program, which takes place at 6 p.m. on May 7th. According to Counselor Felicia Jackson, that those awards will be streamed live, and some sections will be pre-recorded. So that's sort of, another way that these schools are trying to honor their seniors during this difficult time.
Definitely good to hear that. We also want to end on a high note, give you some really good news out of Coosa County tonight. We have a Vietnam veteran, Robert Shaw, who was released from a hospital Friday after a 40-day hospital stay at Central Alabama Veterans Healthcare System.
Yeah, he was the first of that healthcare system COVID-19 positive patients, and he spent 20 days on a ventilator before his release on Thursday. So it's definitely excellent to hear that he is making his way back into recovery, and that's something we always want to hear.
Definitely. Coosa County Sheriff Michael Howell said, he's a fighter, and it's really good to see him getting released, and everybody's really happy to see that, and we are as well. So as always, we want to thank y'all so much for trusting us as your local news source, tuning in tonight, getting the latest updates. We want to thank our sponsor, Russell Medical Wound Care and Hyperbaric Medicine, for all their support as well. And we do want to wish y'all a good weekend. We will be back for our show on Monday at 7 p.m. and continue to come to you every weeknight and give you any updates over the weekend as well. So thanks y'all for tuning in. Again, I'm Santana Wood, Managing Editor, alongside Lizzie Arbogast, Sports Editor. Y'all have a good night.